Welcome back to Clinic Annex with Dr. Abosede at Digbite. It's a pleasure to have you back on this program, and today we'll talk about hypotension. I'm doing this on request. Hypotension is the opposite of hypertension. So what are the figures when a person has hypotension? You do know that if it is hypertension, the blood pressure is 140/90 or higher. But in hypotension, it is less than 90/60. 90/60 is okay. In fact, for many people, 80/50 is still acceptable if they don't have any symptoms. But there are people who have less than 80/50, or at 80/50, they are beginning to have symptoms. So what are the symptoms? Yes, a person may have blurred vision, not because they need to wear glasses, but because their blood pressure has dropped. Others may feel lightheaded or frankly dizzy. So it may also be that others will pass out and faint. The danger in fainting is the person may hit their head against something. If that person is an older person or elderly person, they may be at danger of bleeding into their brain because of the trauma up to 3 months after the incident. It is that bad, and that is why it should promptly be taken care of. Yes, hypotension should promptly be addressed when it happens. What are the causes? It could be caused by just merely standing for too long under the sun. We call it orthostatic hypotension. You've been standing for too long. If it is under the sun, you also lose fluid that way, and then the vessels pull blood because you are not working. So the muscles are not acting as a pump to return blood to the heart as they should. Dehydration in diarrhea or vomiting, and the person is losing body fluid very rapidly. Or in acute blood loss, for example, a person who has undergone trauma. It may happen in severe infection of the blood, which is called sepsis. Or it could happen in anaphylaxis reaction. A person reacts badly to a medication or food that they have taken. Sometimes they know that they react to certain medications, so they keep telling you, don't give me this, I don't take it. And we write it also on their cards in the hospital. There are also some medications that can cause, this time not anaphylaxis reaction, but they can cause hypotension through other mechanisms. For example, if you are taking a diuretic or certain medications that make your vessels to dilate. For example, those ones that men use for enhancement of sexual performance. Pregnancy is another cause. And what happens in pregnancy is that the smooth muscles of the body, they are relaxed. And so those of the vessels carrying blood are also relaxed. And this makes them to pull blood. So the big abdomen too can also sit on pelvic vessels and reduce the return of blood to the heart. This can make a pregnant woman feel or have hypotension. Others may also take illegal drugs, and these illegal drugs can have different effects on people. Excessive alcohol intake is another cause, and prolonged standing or rising from a sitting position too hurriedly can also do or cause it. It can also happen to hypertensives who take excessive medications, maybe because they want to quickly lower their blood pressure. Yes, there are reasons to do that, but not often. Yes, if you must lower your blood pressure rapidly, let it be done by a doctor. So what can you do if you experience this? If it is happening while you're standing, please take a seat. If it is happening while you're seated, please find a place to lie down flat. If it is still happening while you're lying down flat, please raise both of your legs. You should get better. But if you can get water, please drink a lot of water. And in addition, you can add salt in that water before you drink it. It is the same principle that we use in ORS. ORS contains not just water, but also some glucose and salt. You can also eat frequent meals. They don't have to be large meals, but frequent small meals. That will ensure that you keep getting fluid back into your system. And then if it is about blood losses, please see a doctor so that it can be treated promptly. And if it is about not eating well, then please eat balanced diet. That will give you nutrition, adequate nutrition, so that what you need to make blood, that your body needs to make blood, will be given your body in your diet. Food that is rich in iron, folate, and B12, so that your body can make its own blood. Then, if you want to get out of bed, please get out of bed in stages. So if you are lying down, first sit up for a few seconds before you stand. And when you stand, before you start moving, stand for a few seconds. This will make your body to adjust so that your blood pressure will come up a bit before you start moving. And if you see that you cannot do it, then you'll be able to return back. But if you just stand up immediately and then move, you might fall if you feel dizzy. Those are the things that we can do. But ultimately, it is important that anyone who experiences this should see a doctor. Yes, so that whatever the cause is can be identified and treated appropriately. And make sure that you are taking fluid regularly on a regular basis. 3 liters of water is advocated for everybody. And so if you always have hypotension, then it should be your culture to always drink water as much as you can. Thank you for watching. I hope it helps. Please share with everyone so that together we can save lives. And do not forget, good health is great wealth. I'll see you again next week, God willing, with yet another topic. Until then, please be safe. Bye.